Hello, my name is Elena. In celebration of the Global First Aid Day, I'm going to discuss with you today the first 8 steps for fracture. First, what is a fracture? It's a complete break, chip, or a crack in a bone. Fractures can be open, when the end of the broken bone breaks through the skin, or closed, when it doesn't break through the skin. It's important, first of all, to recognize the injury or the fracture. So, what to look for? Look for a deformity, look for swelling or bruising. The person may be in pain, or he may not be able to use the injured part of the body. A broken bone may be sticking out of the skin, as in the case of open fracture. And also look for a sensation or sound of bones grating, or the sound of a snap or a pop when the injury happens. Now, after you actually recognize the fracture, now how to care for it? Remember, you should always call emergency medical services or ambulance if there are injuries to the thigh, bone or pelvis, if the area below injury is numb, cold, blue or pale, if a broken bone is protruding through the skin or if you have an open fracture, and also call if you cannot safely move the person. Now, how to care for the fracture? Treat the injury using the RICE method. Have the person rest comfortably. Immobilize, keep the injured area as still as possible. Cool the injured area for at least 20 minutes of every hour. And elevate the injury as long as it doesn't increase the pain. Now, I will tell you about type of splints that we have. We have soft splints that are usually bulky objects like a pillow or a blanket. We have rigid splints that are hard, fixed objects like a board or a branch from a tree. We also have something called anatomical splints, where we use another body part for the support of the injured part. And slings that use cloths looped around the neck to support the upper extremity, if that's the arm or wrist injured. Now I will be telling you how to apply a splint. First of all, check for normal temperature and skin color below the injured area before and after immobilizing the limb. So if the area is cold before immobilizing the limb, then you should always call emergency medical services or ambulance. But if the area is cold after immobilizing, then your splint might be just too tight and you need to loosen it gently. Then you should always remove the jewelry below the site of the injury and immobilize the injured part in position which it was found. Make sure the splint is long enough to extend below the injury and above the injury, and always pad slings and splints for the comfort of the person. Now I will be showing you how to apply a sling.
Have the person hold the injured arm across the body. Slide a triangular bandage under the injured arm. Bring the bottom end of the bandage over the shoulder of the injured side and tie the ends together behind the neck. Make sure it's tight but comfortable. Secure the elbow by twisting, tying, or pinning the corner of the bandage.